I have been on birth control for nearly a decade and I have tried a few. A lot did not work. I have tried the pill, the implant which just sits right here. I have had the patch. I've had the copper coil. I have had a lot. And finally, I have found a contraception which I absolutely adore and would love to talk to you about. My name is Dr. Naomi Cave and welcome to KnowHer, where we get to know our bodies. Before I get into this video, I just want to say that whilst this type of contraception works really well for me, it's not to say that it will work amazingly for you. Luckily in the UK, we have access to free contraception through your sexual health clinic or your GP. I would highly recommend that if you get a contraception that just doesn't gel well with you, that you try another one. Listen to your body and find something that works for you. Contraception is here to serve us. We are lucky to have a wide array of different types of contraceptions, and so we should find the one that works best for us. My favourite contraception is the IUS, which stands for Intrauterine System. I currently use the Mirena Coil. This lasts for 5 years and is actually the largest one and also has the highest level of hormone in it. There are some different types of intrauterine systems that have lower hormones and are smaller. Won't talk about those because I've never had experience with them. All I've had experience with is the Mirena. The IUS is a small, flexible T-shaped device which is inserted into the womb. I might also use the word uterus, but they mean the same thing. So it goes up the vagina, through the neck of the womb, the cervix, and into the womb. It is inserted by a doctor or a qualified nurse who knows how to do it. Once it's inserted into the womb, it will have two little handy threads that come out. These are really important. They let you know that your IUS is still inside the womb, still working away its magic, and also when it's time to get rid of your IUS, it's really easy to get it out. I've already alluded to this, but the IUS is a hormonal contraception. It contains slow release progesterone, and that's what helps you to prevent pregnancy. The progesterone acts quite locally, and actually very little of the hormone goes into the blood system. It does two things. Firstly, it thickens the mucus at the neck of the womb. This is to stop any swimmers from getting into the womb. Secondly, if one persistent swimmer does manage to worm its way through, it also thins the lining of the uterus. This is incredible. You have a fertilized egg. It tries to get cozy and comfortable in the lining of your womb, but your lining of the womb is not a cozy, comfortable bed. It's like a thin, dry, hard, rocky place. Okay, it's not that thin and dry, hard, but like you get it. It's not as cozy and as juicy as a lovely, fluffy bed. It's thinned, and so even if it does get fertilized, the fertilized egg won't be able to implant into the womb, and you won't be able to have a baby. Yay! Another great thing about this is because it thins the lining of the womb, it means that your periods are lighter. It's incredible. Now, because of this, it's actually used to treat things like painful periods and heavy periods. And actually, it's also used to treat endometriosis. Having been on the IUD, the copper coil, prior to starting the IUS, rest assured, it's miles apart. I had heavy, painful bleeding that caused all sorts of problems, including anemia with the IUD. And then coming onto the IUS, it was a breath of fresh air, lighter periods, less painful, and just it was incredible. About 20% of people don't get their periods at all. I think this is a myth. I know it's not, because my friends, some of them don't get periods, but it doesn't matter what kind of contraception I have. If it says you won't get a period, my body will say, okay, I hear you, sir, but I'm still coming. So I still get a period, and it's quite thin. I only need panty liners, and it's about 1 to 2 days in length, and it is amazing. Another pro about the IUS is it does what it says it does. It protects you from having babies. It's very effective. You insert it in once. Yes, it's a bit crampy and painful at the start when you first get inserted. It's a bit like a period cramp. But after that, you leave it for 3 to 5 years and you come back again and do it all over again. But let's talk about some of the cons. Seeing as I'm already talking about babies, let's talk about sex. It does prevent babies, but it does not prevent STIs. I would always recommend that you get an STI check every 3 years if you have a regular partner. I don't care if he's your husband. Yes, love my husband, but every 3 years I'm still getting that STI check. I'm sure some sexual health worker told me once and it's just stuck with me. If, however, you're changing partners, I would say before having unprotected sex with any new partner, both get tested or use a condom. And this will only become an issue for some people when it comes to family planning and you realise because you've had an STI, you're now infertile or it's harder for you to get pregnant. So make sure you get tested. And whilst it does say that it shouldn't interfere with sex, I can count a number of times, just a handful of times, when the threads have been felt by my partner during sexual intercourse and it's caused a bit of discomfort. As I said, it's a handful of times over 4 years, and really it's probably just the positioning of it. And once you kind of jiggle it about and, you know, pop a finger in and just move it around, then it's fine. So yes. Another con is you might have irregular bleeding. Now this is a bit annoying because you just have to make sure you have a change of pants and sanitary wear wherever you are, because boom, you could have a little period. But that settles down after 6 to 12 months. Now let's talk about some of the scary things, but also the less common things. Your IUS may come out without you knowing. For me, this is the most scary thing because then it's not doing the job it's meant to do. If I don't know that you are out, then how can you protect me against an unplanned pregnancy? This happens to about 1 in 20 people. So this is why they tell you to check your strings, your threads, especially during your period, because that's when it tends to happen. And if you do notice that your strings are no longer there, I would highly recommend that you use condoms. If you have been sexually active, then I would recommend you get emergency contraception, and then also contact the sexual health clinic or your GP to make sure that everything is okay. Another con is when fitting the IUS, problems may happen. What may happen is the IUS system may go through the lining of the womb and cause something called a perforation, which is just a hole in the womb. Now the thing is, our bodies, they fix themselves when they're injured, so your womb will normally fix itself, but then your IUS might be missing and you might need surgery to remove it. And for me, that sounds quite scary, but that's why you just need to make sure that you can feel your strings, because usually a sign of perforation is you can't feel your strings or you feel pain. I've already mentioned that this is a hormonal contraception, but it does act differently to other hormonal contraceptions because it usually acts locally and very little of the progesterone gets into the bloodstream. But for some people, they might find that they also get some hormonal side effects. So these include mood swings, fluid retention, increased acne, breast discomfort, increased breast size, very slight increased breast size, but very temporary as well, and also reduced sex drive. So there you have it. For me, I had very few, if any, side effects. If we're talking about the hormonal side, I feel like the mood swings I get are quite similar to a normal cycle. Obviously, I haven't had a cycle for a while, which is without birth control, so I'll have to compare that in a few weeks when I eventually take out my IUS. But what would normally happen is a week before my period, start getting sugar cravings. I will have a short temper, maybe a bit sad, a bit happy, so I will be a bit moody. But I think that's kind of regular to the normal cycle, and I think that gives me confidence. During ovulation, the sex drive is high, so I really have just enjoyed having this contraception. Obviously, this is just my personal experience. I would love to know what your favourite contraception has been, how your experience has been on the Mirena, and any tips that you have for us, because let's learn. I hope you enjoyed this video, and until next time, have a good day.